Hi, my name is Danielle Anderson. I'm a naturopathic physician and acupuncturist here in Portland, Oregon. And today we're going to talk about a few things that we see very commonly with our patients and our clients as far as their body structure.
And I am Andrea Leonard, personal trainer, corrective exercise specialist, and performance enhancement specialist. I have been training young and old for 25 years and am a national presenter and published author. And I am also working here in Portland, Oregon. So today I'm going to talk about something that I see all too often with my clients, and that is what I term forward head. Some people refer to it as looking like a chicken. It's interesting because for every inch forward that the head is, and most people don't realize that the way we line it up, I'm looking at how the earlobes line up in the clavicle, and most people are half an inch to an inch forward, that it is the weight of the entire head on the cervical discs. So imagine walking around with a bowling ball hanging off your chin and how much pressure that puts on your neck. Well, because the neck, of course, is attached to every other element through the body through the kinetic chain, that can affect the spine. It can end up affecting the hips, the knees, the feet. So we have to address, starting at the top, how to correct this imbalance. And something that's really simple that somebody can do just in their car. So, you know, you're at a stop sign, you're at a stoplight. I have them sit up nice and tall against the back of the car seat. Now there's a couple components here. I want them to draw their abdominal muscles in so that they keep their pelvis in neutral. I also want them to retract, which means to bring back, and then also depress their shoulders. Now that doesn't quite solve the problem with the forward head yet, but if we have them bring that head back into alignment, gently pressing on the back of that car seat headrest, you can feel the back of the neck open up, and it feels so good. You will know if you're that person and your neck muscles are really tight. You'll feel that release. Now, the most important thing is if somebody has high blood pressure, they do not want to hold their breath, and most people have the tendency to go. That will elevate their blood pressure. So it is important to, one, not hold it that long if you have high blood pressure, and two, make sure you're breathing in and out. For the average person though, I would actually encourage them to continue to press back for 3 to 5 seconds, keeping their chin in neutral. It shouldn't be tucked down, nor should their head be tilting backwards. And just gently push straight back for 1, 2, 3, 4, 5, and then you can just relax everything.
All right, so that was a really awesome explanation, but we're going to talk about it from my perspective, which is we also see that people have a lot of structural issues because they have a ton of internal issues going on. So let's put Andrea back into that same position, that forward neck position that we talked about earlier.
Line up my body a little better.
Okay, right there. So some of the things that I would look at as a naturopathic physician who's trained in this type of movement, exercise, and muscle conditioning is I would look at why is the neck in this position? Probably because we have some weakness on those posterior muscles in the back. These muscles, from a Chinese medicine perspective, are actually related to the stomach, the digestive system, and the gallbladder. So those are 3 things that I would actually go and look at when I'm seeing somebody with this kind of position. Okay?
Mm-hmm.
Great.
I feel really weird. Okay, so Danny, just like I was talking about earlier about doing the exercises in the car and being able to isometrically press your head back against the car seat headrest, let's just use my hand kind of as an example.
Okay.
So you want to keep your chin in neutral. Most people tend to tip it up or down.
Okay.
Shoulders back, retract the shoulders, pull the belly button towards the spine, and just pretend you're sitting in your car seat, and I want you to push straight back, breathing in and out, and we'll count 5, 4, 3, 2, 1, and then just relax. And then again, we'll retract your shoulders, belly button in, pelvis neutral, chin level. Go ahead and push straight back, breathing in and out. 5, 4, 3, 2, 1. So that's one version that, of course, you can do virtually anywhere with or without the car seat headrest.
And then as I'm doing it, can I use some counter pressure on the steering wheel?
Absolutely, and I'll do that a lot, and it relieves so much, and that'll help you to retract the shoulders. Then, of course, make sure that you're keeping them depressed because most people tend to elevate, especially if they have naturally tight traps. And then another thing that we can do, which is really nice, you can do it first thing in the morning or when you go to bed at night. Let's just go ahead and have you lay on your back, feet up, knees bent. I'm going to use this. Go ahead and scooch up so your head's not hanging off the bench there. Not quite as comfy as a king-size bed. So we'll just pretend this is a pillow like you would have at home, and this is just so simple.
press your head back against this pillow and breathe in and out and hold it for 5, 4, 3, 2, 1. And you feel that huge stretch up the back of your neck, and then press straight down again. 5, 4, 3, 2, 1. So what we're doing there is we're actually isometrically contracting. Like you said, these muscles are overstretched and weak. These ones might be too tight, drawing the head forward. So it's basically creating that balance and determining which muscles need to be stretched and which muscles need to be strengthened. And that, along with the work that you do, helps us to give somebody a completely integrative program and get them the best results possible.